Good afternoon, students. Welcome in HCP lecture. Today I will start the lecture of hospital and clinical pharmacy. New chapter is pharmacy and therapeutic committee. Let us firstly shortly look at what we saw in the previous lecture. Nomenclature and uses of surgical instrument and hospital equipments and health accessories. In that introduction, scissors. In scissor, straight blunt scissor, then straight pointed scissor, angle scissor, then switch cutting scissors for switches, and blisters bandage scissors to cut the bandage. Then B is tissue forceps. In tissue forceps, Bocox untoothed tissue forceps, then toothed tissue forceps. C is the hematostatic forceps. In that, the other name artery forceps for this is an incorrect name. These are used to check the blood flow from the vessel. Then next is towel clip or corner clip. In that, Donis type, Grace type, then Backhouse type, and Moynihan's tetratowel forceps. Then next is dissecting forceps. In dissecting forceps, first is plain dissecting forceps, whose inner side is serrated and has a spring-like handle. Toothed type, which are either Millins type or Victor Bones type. Then scalpels and their blades. Then needles. Mainly they are the two types: hypodermic needles for parentals and surgical needles, which are solid and used for the switching. Then next is needle holders, then rubber catheters, then miscellaneous instruments. In miscellaneous instruments, tongue holding forceps, then sponges holding forceps, bone cutting forceps, bone holding forceps, then piles holding forceps, intestinal clamp, laminectomy saws, that is Horney's type. Then other equipment, in other equipment, ECG machine, X-ray machine, then Doppler's echocardiography, then video monitoring equipments, then glucometers, that is blood glucose meter, and CT scanner. In CT scanner, head, orbit, ear, neck, then CNS, abdomen or pelvis, spine, extremities, joints, 3D. Okay, then ultrasound sonography, then magnetic resonance imaging, and lithotripsy. And last point of this chapter is health accessories. In that, ambulatory aids and bedside aids. In bedside aids, wheelchair, walkers, and cane and crutches. Okay. Now, today's I will start the new chapter of hospital and clinical pharmacy. In that, part 1, hospital pharmacy, chapter is pharmacy and therapeutic committee. Now, see the introduction of this chapter. The medical staff are responsible for the policies and practice of drug utilization within the hospital. Then, this is carried out by the medical staff in cooperation with the pharmacist and representative of the other disciplines as required by forming a medical staff committee. This committee is privacy and therapeutic, that is P&T committee. Then it is an organizational lines of communication between the pharmacy department and the medical staff. Then it evaluates the clinical use of drugs, develops the policies for managing drugs use and drug administration, and manages the formulary system. Okay. In then next point is composition of PTC. In composition of PTC, in composition of the PTC, the Pharmacy and Therapeutic Committee is composed of representatives from all and healthcare system. Then it can be elaborated schematically as below. These are the P and T committee. In that, first is physicians, second pharmacist, nurses, and administrators. Then physicians again classified in the three part. First is general medicine, then general surgeon, and anesthetics. Okay. Then A chairperson is appointed from physician representative and a pharmacist work as secretary. Then next point is purpose of PTC. Purpose of PTC. The Pharmacy and Therapeutic Committee works with two main objectives or purposes as below. First is educational and second is the advisory. In educational, PTC recommends organizing programs, seminars or workshops to furnish the current development on matters regarding drug and safe use. Then advisory PTC emphasis on implementation of policies laid down for the selection, evaluation and rational use of drugs in hospital. Then next point is agenda of the committee, and that the success of meeting depends upon the nature of the agenda, which is made available to the members of the committee before scheduling the meeting by the secretary. Then a typical agenda may be consisted of the following points. First is minutes of the previous meeting and review of hospital formulary section, either addition or deletion of product. Then adverse drug reactions reported in the hospital since the previous meeting, in that drug safety in a hospital. Then the meeting of the committee should be at least 6 times in a year and whenever necessary. The minutes of the meeting as prepared by the secretary and he is supposed to maintain the record permanently. Then the recommendation will be presented to the medical staff for their implementation. Okay, and function and objective of the P and T committee we will discuss in next next lecture. I will stop here. I will revise the today's part of the chapter. Firstly, introductory part. In that, this is carried out by the medical staff in a cooperation with the pharmacist and representative of other disciplines as required by forming a medical staff committee. Then this committee is pharmacy and therapeutic, that is P and T committee. It is an organizational lines of communication between the pharmacy department and the medical staff. Then next point is composition of PTC. In that, pharmacy and therapeutic committee is composed of representative for the work of their health care system. In that, P&T committee classified in 4 part. First is physician, then pharmacist, nurses and administrators. And physicians again classified in 3 part: medical, general surgeons and anesthetics. Then next is purpose of PTC. In that, pharmacy and therapeutic committee works with two main objective purposes. First is educational and second is advisory. Educational, PTC recommends the organizing program, seminars and workshops to furnish the current development on matter regarding drug and safe use. Then advisory, PTC emphasis on implementation of policies laid down for the selection, evaluation and rational use of the drug in hospital. Then last is agenda of the committee. A typical agenda may consist of the following points, that is minutes of previous meeting and review of hospital formulary section, either addition or deletion of product. Then adverse drug reaction reported in the hospital since the previous meeting, that is drug safe in hospital. The meeting of the committee should be at least 6 times in the year and whenever necessary. The minutes of meeting are prepared by the secretary and he is supposed to maintain the record permanently. Then recommendation will be presented to medical staff for their implementation. Okay, I will stop here. Remaining part of this lecture will be seen next lecture. Okay, thank you.